So thank you. So stay here. So it's my pleasure to welcome Mrs. Virginie Gouteux. It's a good friend and also a patient. I've taken care of her. She is living with kidney cancer for now up to 7 years, and she has undergone multiple surgery and faced the challenge of vulnerable disease. Virginie's experience underscores the critical role of innovative treatments in improving patient outcome and offers valuable insights into the impact of advanced therapy on patients' lives. And thank you, Virginie, for your talk.
Thank you, Mr. Ouda. So my name is Virginie Gouteux. I will be 57 years old this month, and as you can hear, I'm French. Firstly, I will tell you how I live with kidney tumors until the age of 50, and secondly, how my involvement in a drug trial protocol changed my life. I have Fonny-Paul-Lindau disease, which you know is a genetic disease. It's a mutation of the VHL gene, which normally acts as a tumor suppressor. Fewer than 3,000 people are affected in France. My mother was a healthy carrier and passed away at 81, but my brother had a lot of manifestations of this disease and died quite early at 39, and finally from a pancreatic neuroendocrine tumor. As for me, I'm fortunate to be partially affected by this disease because it has only manifested in my case through pancreatic cysts, hemangioblastomas in my cerebellum, and of course, kidney tumors. While I have only undergone 2 cranial surgeries, I have had 5 on my kidneys. The first one was in 1992 when a urologist completely removed my left kidney because of a single but central tumor. At that time, it seemed to me more like butchery than cancer treatment. Certainly because techniques like radio frequency or cryotherapy did not exist, neither than partial nephrectomies or delicate resections. After that brutal episode, as I recovered quickly and had no after effects, my life continued because one can live very well with one kidney, with only one kidney. And I acted as that brutal episode was just a bad memory. I just want to make a first stop here to underline that the psychologist side, how the patient faces the disease, is at least as important as the way you doctors follow the patient and gives him the right treatment. I decided to only see the bright side of life, and gradually, as everything seemed to be going well, I lost the habit of having my annual checkups, and I forgot the disease, and it was like it had subsided. But this is a genetic one, and you know it's in me. So about 10 years later, it reminded me through a large hemangioblastoma in my cerebellum. And after my surgery from 2009, it manifested as the relentless growth of kidney tumors on my only right kidney. And of course, I underwent several radio frequency treatments and 2 delicate resections on my only right kidney. Miraculously, my kidney function remained normal. and likely due to the great skill of all the doctors and specialists who operated on my only kidney, as well as my efforts to avoid much salt, much red meat, to exercise, and to drink a lot of water, of course. And I want to thank you very much, the doctors who operated in me. Arnaud Méjean did twice, and Professor Correas for the radio frequency treatments. Thank you very much. When at the end of 2018, Professor Richard, who dedicated all his research career to find an effective drug to struggle the disease, when he called me, I thought he was once again calling me to schedule another surgery on my unique kidney. But no. He was calling to invite me to participate in the belzutifan drug trial protocol. And of course, as I had nothing to lose, I jumped into the chance and began the trial. And this is the second part of my story. It completely changed my life. As soon as I tried the medication, I felt it healing me. I have very large cysts on my pancreas, as I said, and they were causing me back pain and stomach aches. And in the first weeks, I felt that the cysts were shrinking, literally. And what was the most important, the first scan and MRI showed that the kidney tumors were also shrinking. It was like a dream, almost a miracle. Better than that, it was real. For the first time, doctors found an effective drug to struggle this disease. I won't recount all the steps of the protocol, but to keep it simple, when I began in 2019, I had 5 tumors on my only kidney, and the largest was nearly 30 millimeters, and nowadays I only have 3, and the biggest is 22 millimeters. So this drug has literally changed my life. I haven't had any surgery since 2017, and therefore I have no longer that sword of Damocles hanging over my head regarding the potential loss of my normal kidney function. I came back to full-time work and took in charge an administrative and financial service. And also, I travel and live normally, a completely normal life. Of course, there are side effects. I won't deny them: fatigue due to grade 2 anemia, hypoxia, cramps, and nowadays diabetes. But you know, what a patient endures must be seen in the light of he's gone through before, and his disability, of course. Since I always thought I would lose my normal kidney function and need one day dialysis, all that side effects are for me very bearable. Of course, it's due to the specialists who helped me to move on with my life, but also to my very strong moral and mind, and the fact that my husband has it too. So I think I truly want to underline and emphasize that moral plays a huge role on the way to the recovery. So, a little message for the doctors. Please, doctors, when you announce an illness or a treatment to your patient, please try to be a little bit psychologist, and above all, be positive. For people who don't know, they don't even suspect I am sick. When I was younger, I tried to forget the disease, even denying it. But later on, I learned to accept it. And nowadays, it's a companion life sometimes I struggle with. To conclude, I agreed to share my story today to tell all patients that medicine is advancing, that thanks to the hard work of specialists and doctors and researchers, medicine is progressing, and some cancers that people used to die from just 10 years ago can now be cured or stabilized. I want to give people hope. I want to give hope to all patients. And I thank IKCS for inviting me and giving me the opportunity to do so. If I have been able to give or restore hope to patients with kidney cancer, I'm happy. And my testimony will not have been useless. Thank you very much for listening to me.
Well, that's a very easy thanks I've been asked to give, isn't it? Virginie, that was absolutely spectacular, and thank you. Thank you so much for spending the time to share your experience and insights with us. We really do appreciate it. And I think after a morning of some wonderful sessions, for really helping us focus on why we are here. So thank you once again. And so with that, it is now lunchtime, and so please join us in the Grandbert Saal for lunch. There's a big room out the back. Pick up your lunches and then move across to the next door room where we have our industry-sponsored symposium, the excellently titled Kidney Cancer Puzzled, where Manuela Schmidinger, Gunhild von Amsberg and Guillermo de Velasco will be sharing some further insight. So don't miss that. Off you go for lunch.